Hello, welcome to the March 2021 issue of the NHF Provider Newsletter. We take this time to express our gratitude to all pharmacy owners, pharmacists, and pharmacy technicians for your continuous commitment, cooperation, and support demonstrated as partners of the NHF programs in the delivery of healthcare, especially during this COVID-19 pandemic. Since September 2020, the NHF has successfully incorporated the JADEP card benefits into the NHF card. This initiative allows beneficiaries to have access to all the great benefits of the NHF card and JADEP under one card, the NHF card. With the merger of the NHF card and JADEP card, the limits are the same. So, where stocks allow, JADEP beneficiaries can now get up to 90 days supply. NHF has also commenced issuing a newly designed NHF card. However, the existing cards are still valid, including the JADEP card.
The transaction adjustment is a change made to a previously submitted claim as a result of the submission of inaccurate claim details by the provider or where subsidy payments are made by NHF for invalid claims. The transaction adjustment process authorizes the NHF to reverse claim transactions from you, the provider. The transaction adjustment is required for the following purposes. 1, to eliminate the risk of beneficiaries not being able to access benefits at a later period. 2, to maintain accuracy of beneficiary claim history. And lastly, to ensure that the correct subsidy is payable for the corresponding quantity of pharmaceuticals, supplies, and tests provided to our beneficiaries at the point of service. As part of our continued process improvement, we have revised the transaction adjustment process for greater efficiency and, most importantly, for your convenience. Providers are now able to submit the reversals electronically. However, providers are allowed to do claim reversals up to 3 days after submission of transactions. Please look onto a demo that tells you exactly how to complete the transaction adjustment form online.
In regards to the reversal using the intranet, it's very effective compared to the old system where we would write up the adjustment form, fax or email it, and then we'll have to call customer care in order to find out if they received the fax and wait until whatever to be sorted out is sorted out, so that at that time the patient have long waiting time. So now with using the intranet, it's very efficient. The patient has less waiting time and it's faster, thanks to NHF.
National Salt Awareness Week was recognized in March with the slogan, "More flavor, less salt." Salt is one of the factors that raises your blood pressure, and high blood pressure is a significant risk factor for stroke, chronic kidney disease, and obesity. The reduction of salt or sodium consumption is one of the most cost-effective interventions to prevent illnesses such as hypertension. Now, here are some tips to reduce your salt intake. Choose unprocessed whole foods. Eat plenty fruits and vegetables, especially those in season. Check food labels before you purchase to help you choose less salty options. Eliminate salt and salty sauces off the table. Use herbs, spices, garlic, and citrus in place of salt to add flavor to your food. And cut back on processed meats.
The JADE program is to provide greater accessibility, options for beneficiaries to have their prescription filled at a single location, and to minimize the inconvenience, thereby enhancing medication adherence. We at the NHF are committed to working with suppliers to improve the availability of drugs to ensure our providers have adequate stocks available. Providers are within their rights to refuse short-dated items. It is a requirement of the NHF that drugs being supplied must have a shelf life of at least 18 months. If you are in receipt of any short-dated items which you are unable to utilize within the stipulated timeline, please inform the NHF and return the items to the supplier immediately.
The provider agreements are non-transferable. Therefore, whenever a pharmacy is sold or change ownership, provider status under the NHF program is not automatically transferred to the new owners. In cases where the provider has the intention to close the pharmacy or it is up for sale, we're encouraging the providers to give 30 days notice in writing to allow for the NHF to carry out the necessary audit and retrieval of drugs to be done in a timely manner. The foregoing, along with the proper inventory management, should reduce the incidence of expired pharmaceutical on the shelf as well as financial losses.
Again, thank you for your invaluable partnership in the delivery of healthcare as we work together creating greater accessibility to medications and improving lives. We are also encouraging you to stay safe, wash your hands often, physically distance, and wear your mask properly. The National Health Fund, your partner for a healthier you.